Hypertension Screening and Education.
I'm Lexi.
I'm Olivia.
I'm Hannah.
I'm Sophia.
And I'm Briar. Today, our objectives will be educate others on the importance of screening, overview preventative measures of hypertension, and discuss lifestyle changes to reduce the risk or symptoms of hypertension. What is hypertension? Hypertension is high blood pressure condition affecting the body's arteries. High blood pressure leads to the heart having to work harder to pump blood. There are two stages of hypertension. The first stage, the systolic, ranges from 130 to 139, and the diastolic from 80 to 89. The second stage of hypertension, the systolic, is 140 or higher, and the diastolic is 90 or higher.
Importance of screening. Screening is checking a patient's blood pressure who may not have symptoms to detect hypertension early. Screening is done by a manual cuff and a stethoscope or an automated machine. Hypertension often does not have symptoms, but if left untreated, it can significantly increase the risk of heart attacks, strokes, kidney disease, and heart failure. Types of screening. Blood pressure is usually taken with a blood pressure cuff. This can be done in a clinic, hospital, doctor's office, or even at your own home. If a person is diagnosed with hypertension, a series of tests are conducted. First one is ambulatory monitoring, which tracks the patient's blood pressure over 6 to 24 hours. Lab tests can be done, which just test urine and blood in order to give insight on certain conditions that worsen hypertension. And an EKG can be done, which just measures the person's electrical heart activity, so it determines how fast or how slow a heart is beating.
Preventative measures. With the proper preventative measures, hypertension can be prevented or controlled before complications occur. The first preventative measure is to have regular screening starting at 18 or even earlier if there are any known risk factors. Our second measure is going to be an annual checkup with a primary care provider. Our third measure is going to be you can monitor at home if you are at risk or if you had a history of elevated blood pressure in the past. Consequences of uncontrolled hypertension. Serious damage to the heart, arteriosclerosis, which is the hardening of those arteries, heart attack, stroke, kidney damage that can lead to kidney failure if unprevented, and heart failure. Treatment options. There are two types of treatment options, lifestyle changes or medications. Lifestyle changes we'll talk about in just a little bit, but medications are more of a direct route. So there's ACE inhibitors, which help relax blood vessels, making it easier for the blood to flow. ARBs, which are just like ACE inhibitors, but they go through a different pathway. Calcium channel blockers, which are going to help widen those blood vessels so that the heart doesn't have to pump as hard, and then diuretics, which act as a water pill. They make the body get rid of extra salt and water, which then is going to reduce the blood volume, which therefore reduces the blood pressure.
Lifestyle changes to prevent or improve hypertension. The first one is to make sure you get enough sleep. Sleeping helps your heart and blood vessels rest to keep them healthy. Another one is alcohol use, which should be limited. Men should have no more than 2 drinks per day regularly, and women should have no more than 1 drink per day regularly. The last one is to limit stress. Prolonged stress can increase your heart rate and your blood pressure. Exercise and weight management. In regards to exercise, you should try to get at least 150 minutes each week of moderate activity, like walking, cycling, or swimming. In regards to weight management, keeping yourself at a healthy weight also reduces the risk of hypertension. Diet. Improving your diet to help hypertension. Eating a variety of foods rich in potassium, fiber, and protein, and lower in salt and saturated fat can reduce the risk for hypertension. You could also follow the DASH diet, which makes sure you eat lots of fruits, vegetables, whole grains, lean proteins, have a reduced sodium intake, and to limit processed foods and sugary drinks.
And now for the USPSTF guidelines. The first is for children and adolescents. There is not enough evidence to determine the benefits or harms for screening in high blood pressure for children, so therefore the grade is I. For adults and seniors, it's recommended that all adults 18 or older get frequent blood pressure screening, and so that grade is an A. For pregnant people, checking blood pressure regularly during pregnancy is recommended, so that grade's a B. And then for adults at risk for cardiovascular diseases, it's recommended that you are referred to counseling programs for help with your management. For our questions. First is, which of the following is a major consequence of uncontrolled hypertension? What is the minimum blood pressure reading that meets the definition of hypertension? Which of the following is a recommended lifestyle change to help prevent or manage hypertension? Here are our references.